Dr. Florence, thanks a lot for joining us this afternoon. 40 seconds globally, somebody's taking their life. That says something about the state of society and maybe even the state of our mental well-being in society in 2019, Doc?
Yes, that's very true. Every 40 seconds, somebody takes their life. And Africa, unfortunately, has, while the rates of suicide are going down in other regions of the world, Africa, unfortunately, has a rising rate of suicide. In the global figures, Lesotho is number 3, and among the top 10, we also have Equatorial Guinea and Cote d'Ivoire, and Uganda as well. So, yeah, suicide is a big problem in our region. We need to begin to do something about it.
I mean, these rates are actually higher than European countries, China, as well as the United States of America. So I must ask you, what is happening in Cote d'Ivoire, Equatorial Guinea, as well as Lesotho, that the rates are higher than even European countries, China, and the United States of America? What is the condition of people in that area?
There are many things that contribute to suicide. On the one hand, we have the harsh economic conditions. If countries are going through a recession, for instance, that can cause people to get discouraged and to commit suicide, because when they feel like there's nowhere they can turn to, if there's pressure at work, it's another reason. We also have people who may be suffering from depression and they don't have access to treatment, and they too, and this is a big problem in sub-Saharan Africa, because a big percentage of our population actually doesn't have access to mental health services when they require it. So these are some of the reasons why we see a rising rate of suicide in the region.
I mean, I want to speak about one particular region as well. That's Ethiopia, because facts are saying that actually it's estimated that 20, and I'm shocked by this, 20 million people have mental health issues in Ethiopia, but only 10% have access to treatment and less than 1% have received specialized care. But 20 million people in Ethiopia have got mental health issues. How?
I think it's about the issues. We have to be careful when we talk about the mental disorders or specific mental diagnosable conditions and mental health issues. There are some surveys that can be done that look at the burden of possible mental health problems. If you use a screening instrument, for instance, it can show you that people may be suffering from 1 or 2 or 3 of the symptoms, which together could make a disorder, but it may not be a disorder. So there are also people who, because maybe conflict or being displaced, and we know there are people who are displaced in Ethiopia. We know there have been famines there. We know there's a lot of poverty in most of our countries, not just Ethiopia. So you find that because of all these reasons, people will express some sense of distress or what we call psychosocial issues, which could also be called mental health issues, but they may not be overt mental health problems. So we have to be careful about that. But I think the more worrying figure is the number of people who have access to treatment. If they say only 1% have access to treatment, that is very, very worrying, because if you have a problem and you worry about, do I have a mental disorder or not, should I see somebody, but you have nowhere to go, that's a big problem. That's a big problem for the region. We have scarce human resources. Many countries are still working on their policies and developing their strategic plans, and therefore even just the infrastructure around which the mental health services could be organized is not there. We have outdated laws. We also have laws that discriminate against people with mental disorders, and therefore people are not encouraged to go to hospitals. So all these things combined make it very difficult for people to access the care that they should be receiving.
I mean, very quickly, in literally 30 seconds, Dr. Florence, how do we find a solution? What's the solution at this point?
The good news is universal health coverage, and I hope you covered that last week. or was it the week before? We had the United Nations General Assembly, which focused on universal health coverage. And within that, they have prioritized mental health as well. And we know that the SDGs already prioritized mental health as part of the NCDs, and we had an NCD and mental health General Assembly where mental health was included as one of the NCDs, non-communicable disorders. So this focus and prioritization of mental health is slowly being translated into a greater focus on maybe financing of mental health services. And we in the WHO Africa region are also beginning to think about how do we support countries, or we have always thought about, but maybe strengthening what we do. How we strengthen countries so they can strengthen their mental health systems.
Yeah, because it's honestly a big problem, Dr. Florence, but we're going to have to leave a conversation there for this afternoon. Thanks a lot for joining us and shedding some light in terms of exactly what is happening on the African continent, especially where mental health and well-being really